Tonight, in the second part of our series, Bitter Medicine, we'll take a look at the reason the pharmaceutical industry gives for high drug prices.
6 News First reporter Donnie Rolls takes a look at the pharmaceutical industry's research and development costs.
The drug industry says high drug prices are a result of very high research and development costs. They say they need high profit margins to recover money they spend on R&D. Tonight, we'll show you why the industry's rationale is a tough pill for many to swallow. The pharmaceutical industry says they're a research-focused, innovation-driven industry.
In this day and age, if you want to survive as a research-based pharmaceutical company, you have got to be innovative.
Dr. Marcia Angel is former editor-in-chief of the New England Journal of Medicine and author of The Truth About the Drug Companies. Angel says drug makers aren't holding up their end of the bargain.
Very few innovative drugs come out of the pharmaceutical industry.
She says innovative drugs on pharmacy shelves today were created primarily with taxpayer-funded research done at universities and the National Institutes of Health.
What the companies do is they do pay for the clinical trials, they do sell the innovative drugs, and then they copy those drugs. They make what are called Me Too drugs, trivial variations, and spin them out indefinitely, getting new patents as they go along.
But Truitt points to many new advancements in medicine.
Cancer patients are living longer. Heart disease patients are living longer. We now have, for the first time, Alzheimer's treatments.
Rochester pharmacist Karen Morse says the drug industry is innovative.
I think we still are. I think they're still looking for better drugs out there to treat conditions. I think at this point, any improvement they make helps somebody.
Minnesota Congressman Gil Gutnick questions the pharmaceutical industry's research priority.
So ask your doctor about adding Plavix.
So ask your doctor about Detrol LA, the #1 prescribed brand.
Right now, the pharmaceutical industry is spending by far and away more money on marketing and advertising than they are on research.
It's simply not true. In 2003, we spent $8 billion more on research and development than we did on all aspects of marketing and advertising.
But a 2003 report put out by Minnesota State Attorney General Mike Hatch says 35 to 37% of pharmaceutical revenue is spent on marketing and administration. That's between 2 and 3 times what's spent on research and development. It's hard to find numbers everyone can agree on. That's because while the drug industry does release a composite number for R&D, they don't release individual company reports that would give the details necessary to verify their claims. Drug makers have fought repeated attempts by the government's General Accounting Office to provide individual company reports.
Individual companies don't want to signal to the competition down the street how much they're spending on research and development. It could give away their research project and what they're working on.
Well, that's part of the smokescreen, and I don't buy it.
Gutnick says if companies did release their research and development numbers, it would shoot a giant hole in their rationale for the high prices they charge. But drug companies aren't the only ones investing in new drug research. So are you.
This year, we will spend over 20 billion American taxpayer dollars on research, which ultimately can benefit the pharmaceutical industry.
But Truitt says that $20 billion just gets things started.
It is a big jump. It's like jumping across the Grand Canyon to get from a basic scientific theory to the development of a product, and that's where clearly the companies come in.
Tomorrow night, in the third installment of our series, Bitter Medicine, we'll shed some light on how innovative the pharmaceutical industry is by looking at a pattern in the types of drugs the industry brings to market. Reporting at the Update Center, I'm Donnie Rolls, 6 News First.
Now, tomorrow night, we'll begin to take a closer look at the innovation of the drug industry, as well as what industry critics call Me Too drugs. That's tomorrow night at 6.
Olmsted County planners hoping to